Good morning, good afternoon, or good evening. Of course, that depends where you are in the world. Welcome to the 2026 EUFOREA Global CRSwNP Awareness Day. Well, hello and a very warm welcome to you all. Chronic Rhinosinusitis with nasal polyps, or Nasal Polyp Syndrome, affects millions of people globally. It changes how you breathe, how you sleep, how you taste food, how you smell the world around you. And for far too many patients, the road from first symptoms to proper care is longer and much harder than it should be. And that is what today is all about. This year's theme is redefining the patient journey, because we believe there are specific moments in that journey where patients get stuck and specific things we can do to change that. We're going to be exploring three priorities. The first of those is getting to the right diagnosis faster. Secondly, making sure patients truly understand their condition and the options available to them. And thirdly, knowing when to go back to the doctor, because far too many patients accept symptoms they should not have to live with. But first of all, I do want to say something before we start. Today is not just about what goes wrong. Of course, we will hear stories of frustration, but we will also hear what happens when the system works, when a patient finally gets the right treatment and their life changes, because that really is the gold standard. And that is the ultimate aim of everything we are aspiring to do. Well, let me introduce our panel to you. First up, Shire. She's with us from the United Kingdom. Catherine is a GP, that's a general practitioner. So she brings the perspective of being both a doctor and a patient living with CRSwNP on nasal polyp syndrome. Joining her, Sebastian C. He joins us from Germany. He is a CRSwNP patient. Andrew Knill joins us from the United Kingdom. He is founder and chair of Sinus UK. He also has CRSwNP. Mikaela Odemyr is here from Sweden. She is former president of the European Federation of Allergy and Airways Diseases Patients Association. CRSwNP also runs in her family. And Duncan Boak is chief executive and founder of the charity SmellTaste, which represents people living with impaired smell and taste. Well, a very warm welcome to all of you. Well, let's start our debate with some personal stories. I think these will add insight and a human touch to this. So let's start, if we can, with my first guest, Shire. I would like to start with you, if I may. Now, look, you're a GP. You have spent your life working, diagnosing patients. We know each other. I've interviewed you many, many times indeed. And yet, despite being a GP, you've also lived with nasal polyp syndrome for years before it was identified. Perhaps it's a slightly cheeky question. How did that happen?
I started over 20 years ago, well over 20 years ago, with blocked nose and runny nose, and I just assumed I had allergic rhinitis. I lived in a dusty old house that we were renovating, and so I treated myself. I bought over-the-counter Beckinase spray, as you do, and put up with it.
Right.
And every time I got a cold, I used to get a sinus infection. Every time I went on holiday, I used to get awful pains in my sinuses, but I just thought, oh, well, it's my allergic rhinitis.
And so physician heal thyself, really. But yeah. Did you ever consider it was nasal polyp syndrome?
No, I didn't really know enough about it. I knew you could get nasal polyps, and my mother had nasal polyps, and you used to be able to see them at the entrance to her nose. And I thought, well, if they're that bad, surely I'll get a blocked nose and then I'll do something more about it. But I don't want surgery because it's really not that bad. I'll just put up with it.
So that's so interesting. So you obviously had symptoms. You're a GP. And yet the diagnosis was still missed. Let's move on to you, if I may, Sebastian. Tell us your story. When were you first diagnosed?
Yeah, thank you. Happy to be here. My first diagnosis was 17 when I got to know that I have polyps, but only about the polyps, not like the condition around it and so on. So the first symptoms started when I was like a small child with infections in my ear, recurring, and all antibiotics all the time, and then sinus infections and so on.
And along the way, obviously, you tried different treatments. What eventually made the difference for you?
I mean, surgery I did helped nothing. So it was even worse after the surgery because the body was damaged and then tried to heal again. And that was a very horrible time. The change was with biologic medicine in 2023. That was also the time I got the real diagnosis with the inflammation, the chronic inflammation, and together with the medicine, and it changed my life.
Thank you very much indeed. Let's move on to you now, Andrew. As chair of Sinus UK, you obviously hear from patients every single day. Tell us your story, because you live with both upper and lower airway disease. What does that look like for you in your daily life?
I mean, thankfully, I'm reasonably well managed, but when it was at its worst, that'd be a nose often completely blocked. And by that, I mean, maybe you can get a little bit of air through it, and that blockage means sleeping at night is really difficult. So then during the day, you're fatigued, lost my smell. You lose your smell, you lose your sense of taste. I love food, I love drink. So that's a real part of the joy in my life that went. So they're kind of some of my CRSwNP symptoms, but asthma, common kind of trait growing up, and shortage of breath stopped me doing exercise.
So was there a turning point for you when the right treatment was implemented and you suddenly went, wow, things are so much different?
No, is probably the short answer to that.
Yeah.
It took about 6, 7 years before I was properly diagnosed. I've had 5 operations since then. I take a cocktail of medication every day. And over that time, thankfully, my symptoms haven't increased as much as they used to. So that's certainly not the case of me being cured. And I certainly don't think I'm in as good a kind of case as you are. But I was just fortunate that some of those treatments have kind of stopped the symptoms progressing too much.
Okay, thank you very much. I'm going to jump over you just for the moment, Mikaela, if I may. I'm going to come back to you in just a second. Let's go to you now, Duncan. You represent patients at SmellTaste who live, as we heard, with the loss of smell. Now, that is one of the most bothersome symptoms of nasal polyp syndrome, I think. It's not always the symptom that gets the most attention, but it is obviously one that affects people's lives incredibly deeply, actually. What do patients tell you about what that does to their daily lives, taking away that all-important sensation?
It has an impact on pretty much every facet of someone's life. Not being able to appreciate the flavour of food spoils the enjoyment of that. But then people lose interest in eating, and their nutrition can suffer as well. But then not being able to smell dangers such as gas or smoke, okay, so makes people more at risk of those dangers, but also creates worry and anxiety around it. But then there's also the real emotional aspects of not being able to smell one's partner or one's children, or form or recall memories of the places that people visit through smell. There's so much in there that taps deeply into our psychology, our mood, our emotion, our enjoyment of life, and loss of smell can completely suck so much of that away. And
Mikaela, I will come to you now, if that's all right. Now, you and your family have lived with nasal polyp syndrome. You've spent years advocating for patients with respiratory conditions across Europe. How has nasal polyp syndrome affected you, affected your family, and given everything else that all our panelists have said, does that resonate?
Well, myself, I was operated when I was very, very young with nasal polyps, and all my 3 children has been operated. It worked quite well for some of them, but my daughter had to do a second operation. And like you said, it affects life tremendously. And but especially...
What was the most debilitating part of that?
They were, for my daughter, for example, she always has problem with her ears. Flying was a nightmare. Sleep was affected. There was a lot of snoring. And but I would really say that you have to fight, but in a positive way, to get the right care. So if you are lucky and you meet the right professional, and we were lucky in the beginning because we went to the pediatricians and they were looking at the whole body. But when the transition comes, when you become an adult, it's like your whole body falls apart. You go to the medication, to medicine if you have allergies. You go to the skin if you have problem with atopic eczema. but not one who sees the whole picture, unless you go to allergologist or someone else. But this is a problem.
I mean, so listening to all of you, it's clear that nasal polyp syndrome is something that affects you profoundly, actually, impacts on your daily life, and often unrecognized, the sort of impact that it does have. Thank you very much indeed for the moment. As you heard there, really personal stories that I think have added real color, actually, to this. Well, EUFOREA's Patient Advisory Board has identified 3 moments in the patient journey where things stall and also where change is most needed. Now, they are getting to the right diagnosis faster, understanding your condition and your options, and finally knowing when to act. So let's take them one by one. Let's go to our first priority, getting to the right diagnosis faster. Let's go to our panel now. I'm going to start again with you, Catherine, if I may. Your perspective here is so valuable, actually. You know what it's like as a GP. You've got 10 minutes, if you're lucky, actually, to have a consultation with your patient. And, of course, a list of possible explanations. What do you think a doctor should be asking that maybe they're not asking?
I think they need to concentrate not just on the presenting symptoms that patient comes in with, but look at them as a whole person and see how it affects their lives, but also ask specifically about related conditions. So if they're presenting with no symptoms, ask them about their chest, ask them about their ears, ask them about their eyes sometimes can get affected, and because patients wouldn't necessarily link things like that.
But very difficult as a GP, as you know. Of course, you're under time constraint and you tend to deal with whatever the patient gives to you.
Yeah.
And it's hard, isn't it, to broaden it out like that?
It is. It is. And it depends on your knowledge as a GP to be able to ask the right questions. If you don't recognise that all these different symptoms are interlinked.
And of course, we always say in medicine, you have used questions to confirm or deny your own diagnosis and your hypothesis. So if you don't think about it, you won't ask the right questions. Sebastian, let me come to you now, if I may. If you look back at those years before your diagnosis, is there anything that you think would have made it faster? What do you think was missing for you? Did GPs listen to you? Did they actually hear the whole story?
Sometimes yes, sometimes no. I mean, for me, the most eye-opening moment was when I was part of the study at the university, and they went through everything. They checked me, then I got the score 3 of 3, and so on. And it was the first time I really knew, okay, wow, I lived with a condition all my life. And then they also got the operation or like the reports from the surgery, and there it was standing. They have this chronic inflammation, like this inflammation in my cells, and I didn't know that. He didn't told me, so he didn't tell me. So that was like, okay, I could have known it since I was like 22, but nobody told me.
And do you think that would have made a difference to you?
I mean, kind of. Of course, part of the study was a new medicine, and this changed my life. So I couldn't have it before. So, but to know that you have something, and I was always trying to adapt to kind of a condition I didn't know. Like I was tired every day. I struggled a lot, and I tried to adapt with my nutrition, with everything. I said a lot of times no to my friends because I knew next day would be horrible, and then I would have known why.
Yeah.
And that
so
knowledge.
in many ways, you were robbed of the information, and had you had that, you would have understood, and the puzzle would have been completed.
Yeah. To know that you are like in kind of a chronic inflammation explains a lot. Why you are tired all the time, why you have so much lack of energy, and why your body, falls.
Feels
hard.
like it's falling apart. But on that point, if I may come to you now, Andrew, as chair of Sinus UK, you obviously hear from patients like this whose diagnosis were delayed, not just in primary care, actually, but also in specialist settings as well. But let's take the other side of that. You also hear from patients where actually the system has worked for them. What does it look like? We've obviously heard those case studies where it hasn't worked. What does it look like when it actually does work and works well?
Yeah, it's a good question. We do. You're absolutely right. I come across patients who've had a positive experience. What does a positive experience look like? That's a quicker So progressing through primary care quicker, so that's kind of a key part. Obviously, people can get stuck at the pharmacy. They can get, with the pharmacist, they can get stuck at primary care. So the primary care physician giving you some sprays, that's fine. A spray might be enough, but recognizing, okay, this spray's not doing, I'm going to move you on to ENT. Then there being a short journey from primary care to secondary care, that's a big gap at the moment. That can be 12 to 18 months if you're lucky, particularly in the UK. And then another positive experience is quickly moving to the options at ENT, and if surgery is necessary, moving to that quickly. I would say probably 2 years. I reckon 2 years is probably a good, from early symptoms, pharmacy, primary care,
I mean, that's a heck of a
secondary
lot of time,
care
though,
to
isn't it?
surgery.
I mean, it's a long time, 2 years.
Yeah. And that's what a positive experience looks like in the current system at this moment in time.
Wow. Mikaela, if I may come to you, you obviously have seen the respiratory landscape across Europe. Why do you think upper airways conditions like nasal polyp syndrome are so consistently deprioritized when you compare it with lower airways diseases?
I think when we talk about respiratory diseases, people don't include the nose. They don't see this connection. So this is one of the biggest problems. And when they realize, first of all, that they are chronic, then they realize, oh, I need to take this treatment. This is why patient education is key to know, and also that you get a treatment plan to understanding, yeah, today you are feeling quite well, but you need still to take your medication. So you will feel better for a long time. But you need that time. I know it's very limited time, but again, I think, and I think also what you said, I think you should ask patient, how is the sleep? Because the sleep affects so much. And when they come in with a respiratory problem, you listen to the lungs and everything. But again, this and sleeping, doing this connection. And this is also a patient organization to talk more about it. It's more focused on asthma sometimes.
I think that's fair. I think it's absolutely fair. Duncan, you obviously work with patients at SmellTaste, where their smell loss was finally, I suppose, taken seriously. When it was taken seriously, you talked about how it sort of impacts your entire life. When it is finally taken seriously, what did that mean for the patient?
I think having the recognition from doctors is really important, and for patients feeling listened to and then getting a fast referral on the back of that is crucial. One thing I would mention, though, just on the back of what we've said, is how awareness of CRSwNP for the public is really important, because at the moment I don't think there's enough awareness that it's a chronic disease. And so people don't necessarily know what the signs and symptoms are, and don't necessarily know they should go and see a doctor.
Why do you think that is?
I just think it doesn't. The condition itself, it does not get the recognition it deserves as a chronic disease in the public domain. Not like it doesn't get the same recognition as asthma.
No, it doesn't at all. Mikaela, I see you nodding along there as well. Why do you think that is the case? I mean, clearly that's what we're here to do, which is to raise awareness. Why do you think that is the case at the moment?
If we take, for example, it's pollen season now, and some people don't take the corticosteroids for the nose because they think they have problem with their breathing. So they don't do this connection. And like I said, I think it needed much more awareness about this connection.
Would anyone else like to comment on that? Catherine?
I think because everybody has known for years and years that asthma is a life-threatening disease. Yeah. There's mortality associated with it.
Yeah.
And so you hear about it in the press. It's much more available to everybody that it is a serious disease, and nasal symptoms aren't recognised in the same way because you don't die from a blocked nose unless you can't breathe.
Yeah, I mean, it's a brilliant point, actually, which is actually in the press. Of course, the press sort of just highlights what everyone knows about asthma, about lower airway diseases. And actually, I think you're right. In the press, they don't tend to focus on upper airways diseases, yes.
I also think, and I'd love to know the definitive answer to this, but people have had colds. And I think people think, oh, it's like a cold, I can associate with
Yeah.
that. Oh, I had a blocked nose, but I got over it. And they don't imagine what it's like. It's worse. If you take them back
So it's
to when
just
it was
trivial
worse,
to them.
Yeah, and you find patients are very stoical. They could just, I've just put up with it. And there is a spray, and that might help me just about get through with life. And I don't think it's devalued as a consequence of that.
Yeah, really interesting, yes.
My aunt has recently been diagnosed with having CRSwNP, okay? It took her 2 years of having no sense of smell, okay, being bunged up all the time, not being able to breathe and sleeping properly for her to go to a doctor's. And I think there is sometimes this perception of just, well, I'm bunged up, I can't breathe properly, but it's not worth going to see my doctor about, I'll just put up with it.
Is that across the board, across Europe, or is that particularly stoical British sort of trait where they don't want to bother the doctor?
Also in Germany, yeah, like for myself too, of course. And the problem is also, like you mentioned, it's like kind of a cold, and
Yeah.
of course you can't measure like how you awake or like how much energy you should have if you don't know the normal, and like those infections all the time. People were of course like saying, "Oh, you're sick again." Yeah, sorry, and then I was just. Yeah, okay, maybe I'm just weak, kind of, you know.
Well, you're definitely
but,
not weak.
Yeah, but this is kind of the thoughts you have.
Yeah.
And if the people around you just say, oh, you're sick again, but yeah, it's just a cold, come on, get you together and then just come out and do stuff, but yeah.
So interesting. Thank you very much indeed, all of you, for your insights there. Well, let's now move on to our second priority, and that's understanding your condition and, of course, your options as well. Sebastian, let me come to you first. After you were finally diagnosed, do you think you actually understood what nasal polyp syndrome was? Did you get enough information? Where did you go for that information?
Yeah, I was lucky. I was part of this study in the university, and I got a very good treatment there. So I got all the information I needed. I got all the explanations, all the questions answered I wanted to ask, and then I got the medicine. Of course, I didn't know that I'd get it because it was a blind study, but it was obvious, like from the beginning. It was a mind-blowing, life-changing effect, and it was like every day from then, like every day the same effect, and then it was crazy. It didn't stop.
So you think that your treatment and the way you were explained was pretty much perfect?
From that day, yes. Before, maybe not.
Do you wish, just looking back, and obviously you talked about the fact that no one told you you had inflammation, chronic inflammation, is there something that you wish someone had told you much earlier on?
Yeah, like I said, if you have the knowledge, then you know what's wrong, and then you can also have explanation for it. And yeah, to have the knowledge would have been important.
Yeah, I'm a great believer in that. Knowledge is definitely power. And of course, that's one of the reasons that EUFOREA actually developed its patient portal. Now, that is a free, comprehensive resource built specifically for nasal polyp syndrome patients with information on the condition, on treatments, also what to expect. It's designed to give patients the knowledge that really a 10-minute consultation simply cannot do. So, Duncan, with that in mind, let's bring you in. Now, SmellTaste has been closely involved in patient advocacy for years. What feedback have you had from your patient community about resources like the portal I just described? Does it help? Does it reach the people that you need it to reach?
When people are aware of it, they think it's really, really helpful.
Yeah.
It's a really good question, this, because we recently did some focus groups with some of our volunteers where we gave them some of the different resources that are in the public domain, those from the NHS, those from EUFOREA, and those from a couple of other places as well. And the EUFOREA ones rated the highest, which was great. But none of them knew they existed.
Which is fascinating. Catherine, I'm slightly obsessed with your 10-minute consultations here, but obviously there's only so much you can say. Do you think that a resource like the portal, where you can actually try and explain everything to the patient in the allocated time, but then you can say, right, here we are, this is the portal, you can find more information here. Do you think that kind of resource will have a sort of huge cut-through for patients?
Absolutely, yeah. I mean, had I known about it when I was still a GP, I would have referred everybody to it. And in fact, that's how I found out about my condition. Because I went to the ENT surgeons and I had surgery. But I said, well, what's causing this? Surely there must be a reason that I'm getting polyps. And they said they might come back. And I said, but why? That surely there's a reason for it. And they didn't explain. I found out the information myself through EUFOREA, going on the website. And I've learned so much, not just as a patient, but as a doctor. And I think all doctors, all GPs and all specialists, it's a really, really useful resource.
Fantastic, thank you. I want to come to you now, Andrew, and talk about biologics, if I can, because this is a really fascinating part of medicine, actually. Just in terms of the biologics, and I just want to move on here, because in the UK, we have a particular problem, because there was no access, we know, to biologic treatments for nasal polyp syndrome. But of course, then patients could see what was going on in other countries. They knew they existed in other countries, but they couldn't have them in the United Kingdom, and there must have been a huge psychological cost to the patient for that.
Absolutely. There's a lot of patients that are strong advocates for their disease, and they go online and they search and they go on Facebook groups, etc. And not just across Europe, but across the US, and they're hearing about this new treatment that could help them, and they can't get it, you know, when they go to the NHS, and that's been really difficult for people. I mean, the irony being, I mean, EUFOREA do amazing healthcare professional training programs. The last biologics training program was in London in March, and we only got approval for a biologic in February. You know, so I mean, that is unfortunate. It took so long, but amazing now that the patients in the UK have access to that treatment.
And given that, and those are the vagaries of each individual healthcare system, but given that access has now changed, that's had a huge impact for the patients?
I would love to say yes.
Oh, but you're not going to.
The difficulty is there is no pathway that exists at the moment to get those treatments prescribed. Even simple things that, I mean, the NHS is full. And even on hospital estates, trying to find the room in which you can then administer these treatments is difficult. I don't know of a patient that's had it in the UK yet. At all. So what with 23rd of April, 2026, it was February when it was approved. It is taking time to get the pathways in place. We're looking at rhinology. This is predominantly surgeons. They're not set up to kind of administer treatments in this way.
I mean, we see this in different disease modalities as well. I've seen it in other areas where it's actually taken that passage of time from being authorised and being allowed to implementation and to become clinical practice. Duncan, would you agree?
Yes, yeah, and I think that's it's going to take a bit of time in the UK. So the biologic that has been approved is currently going through NHS specialised commissioning service. What that means is it's been commissioned at 30 different hospital sites, and there are 18 integrated care boards, okay, we're going to get a bit technical now, where that don't have a commissioned site in them. We wrote to all those integrated care boards yesterday to ask them what arrangements they're going to be putting in place to facilitate access to the biologic in their area.
And I don't want to dwell too much on the United Kingdom, but obviously these are huge problems which hopefully we will overcome. Let's move on, Mikaela, if I may. How do we make sure that patient education actually then connects all of the dots, that it doesn't just talk about nasal polyp syndrome in isolation, but it talks about it being part of allergy, asthma, for example, that it's a spectrum of illness?
I think this is where the patient organizations are key. Because, like you said, the resources in healthcare are limited, and we need to work together. And like you said, when a patient is informed, they will ask for different treatment and things like that. So I think the awareness is key here, and I would really. And if you have a disease and you know what it means. And you get stronger. And I mean, for me, for example, I was a tiger mom for my children, positive. But I was really fighting for the right care. And then this is how I joined our association. That is 30 years ago, and here I am now. So this is just advocating. When you have the facts, when you know about the disease and things like that, then it's perfect to advocate. And I just want to share a very nice story now. In Sweden, we have really fought for guidelines for national for allergy guidelines. It took us 30 years. And last Wednesday, it was reality. So they are now launched. So advocating takes time.
Yeah.
So this is also why I think this takes time. But we need to speak more about nasal polyps. And like you said, there are more focus on asthma, but to see the whole picture. We had an event some years ago called saying rhinitis asthma, just to see this connection. So again, I think that patient association together with healthcare professionals, that is key to raise this awareness and for making the patient more aware of what they can ask for and how they can live their life much better, because it's a question of quality of life also.
Of course. Brilliantly said. Thank you very much indeed. Thank you to everyone for their very insightful comments. Let's now move to our third and final priority. And of course, if you remember, that's knowing when to act. Now, that's something that came up really strongly in EUFOREA's patient work. Now, many patients, once they've been treated, whether through surgery or medication, they start to accept their symptoms as normal again. So the smell starts to fade, your breathing gets worse, but crucially, they don't go back for more help or intervention. And the question is, why? So, Andrew, if I come to you first, through Sinus UK, you hear from patients who have drifted away from care, as I described, but you also hear from patients who did actually say, hang on a minute, I will go back, I will get better outcomes. What makes the difference between those two cohorts?
It's difficult to say. Once you, and we've all sort of talked about, and you've talked about the length of journey to getting a diagnosis, to getting treatment, that take a long time, and it can take a lot out of you. And I think you can get to a point where you just accept where you are. And, I think I've been to the healthcare system, this is as good as it's going to be. It does take a lot for someone to say, do you know what, that isn't, I deserve more than this. And I mentioned about, there are patients that will go online, they'll search, they'll go in different groups, etc. Those people are then armed with the information that actually this isn't what good should look like. It should be better than this, and they'll go and advocate for themselves. But it takes a lot.
It does take a lot. And Sebastian, you said you were treated brilliantly well. What finally led you from going from having no information, not enough, to having brilliant care? What was it? Did you go back and you say, hang on a minute, this isn't right?
I mean, I was going to the doctors all my life because I had all the infections, and the infection normally got to a super infection, and then I need antibiotics. So I was at the doctors like again and again, and then you got the antibiotics, and of course, because of the polyps, they said, oh, we would like to make another surgery, and then I knew, okay, it doesn't help because it gets even worse afterwards, and they come back. Like you said, why is it? But they come back because of the chronic inflammation in your body. And then I started to inform myself, because I knew something must be wrong. I didn't know what. I didn't know why I'm always tired and everything and all the problems. But I knew something must be wrong. And then I got aware of this study of a new, to get the approval for a new medication. And I started calling around. And then suddenly I went to Lübeck, actually, near Hamburg in Germany. And then everything started and my life changed.
So if you hadn't been so persistent, your care wouldn't have changed.
Yeah.
So Catherine, putting your GP hat on yet again, when a patient does come back to you with recurring symptoms, what do you think a GP can do better at that moment? How do you guide that conversation? Tricky, isn't it?
Very tricky, because it depends on your knowledge as a GP and the patient's knowledge. If the patient comes back and says, I've done all this investigation and I've found out there's a new treatment called biologics, then you're going to say, oh, yeah, well, okay, you probably know more than I do about it,
yeah.
and I'd better refer you. But if the patient or the GP doesn't have that knowledge, then I think you assume that there probably isn't much more you can do.
And of course, the whole biologic field has been evolving so fast, so rapidly, that many doctors may not be up to speed.
No, absolutely. No, I mean, even the ENT surgeons aren't all up to speed. I asked my ENT surgeon about biologics and they scratched their head. We don't know anything about that. We don't do that, No,
I think it's a major problem, actually. Duncan, if I may come to you now. Anosmia, I suppose it had a massive public awareness moment, did it not, in 2020, in COVID, where everyone, suddenly millions of people around the world actually, suddenly knew what it was like to lose your sense of smell. So that's what, 6 years ago or thereabouts. Has that moment lasted, do you think? Or do you think, like most things, that awareness has now faded?
What's changed is that people know that it's something that can happen to you. Before COVID, this was one of those things, but people didn't even know you could lose your sense of smell until it happened to you. COVID has changed that, but there's still not the awareness or recognition of the impact that it has on people's lives that is needed. And I don't think there's the awareness of just how many different health issues, 139 different health issues cause loss of smell, according to research published last year. So it's something quite significant.
It is. I was very struck in COVID, actually, that suddenly people realised losing your smell meant you lost your taste. And people hadn't seen that before. And that was certainly something I was very aware of, certainly from what people were telling me across the board, whether I was broadcasting or in a clinical capacity. But it's fascinating. And I think human beings do tend to forget if it's not affecting you, you tend to move on. Well, the reality is that nasal polyp syndrome is a chronic condition, and when it's uncontrolled, it tends to get worse. And smell loss can become permanent. Other conditions like asthma can also flare up as well. But here is the other side of that. As we heard, when patients do go back, when they do get the right treatment, the results really can be remarkable, and that is exactly what we have heard today. Now, Mikaela, as someone who has fought passionately for better respiratory care at the highest level, what is your message to patients watching this right now, and they're thinking, oh, should I go back to the doctor, or should I sit here? Is it me? What's the message?
My message is very loud and clear. Seek information. Join patient association if there are some in your country, because meeting someone else in the same situation, because very often you feel very alone. So it's wonderful to meet others in the same position. And then when you go back and say, I'm not helped, please, you have or if you have seen that there is a new medication coming, discuss it with your GP. And if that doesn't help, then you have to seek help somewhere else. But again, when you go together with a patient association, or maybe joining them, because from the beginning, I was fighting for my children. Now I fight for everyone, and together with other patient associations here, because this is key. But when you try, or when you advocate, you should have the fact, you should be kind, and then you meet together with healthcare professionals, decision makers, and politicians, then change will come. And this is also why it's so important to talk about Awareness Day also. So we talk more about the nose. It has more impact than many, many people realize. But just keep on. It will pay off. It took us 30 years, but or you will end up here in Brussels.
Exactly, but after 30 years, you got there, and that shows that persistence really does pay off. Thank you very much to all of you for the moment. Now, before we close, I want to ask each of you the same question. Now, today's theme is redefining the patient journey. So, tell me what really redefines the patient journey for each of you. In one answer, this is a bit tricky actually, in one answer, what would change things the most? Catherine, you're in the hot seat.
I think knowledge. Just find out as much as you possibly can about what your condition is and what can be done about it.
Knowledge, okay, Sebastian?
For me, the biologic, the medicine as fast as possible. It changed everything.
Okay, so again, making sure that you actually know what is available out there and pushing for that. So that's the biologic. Andrew?
I would say, certainly from a UK point of view, speed of access to specialists. So how quickly you can move from primary care to secondary care to somebody who can properly diagnose your condition.
Mikaela?
Empowered patients.
Empowered patients, that's good, very good. And Duncan?
Ensuring that as many people can get access to effective lasting treatment as possible.
Brilliant. Thank you very much indeed. Well, 5 answers, and of course, every single one of those answers is right. So the take-home message is get diagnosed sooner, understand your condition, and if your symptoms come back, this is what we keep hearing, take action, because there may be options you have not been offered. It's important to remember that when you do get the right care, this is also what we've heard, it can change everything. Well, thank you very much indeed to all of my panelists, to Catherine, to Sebastian, to Andrew, Mikaela, and of course Duncan as well, for such an important and open conversation. Now, if you feel inspired after this great panel discussion, now is your time to join EUFOREA and help shape the future of respiratory care. And you can find out more information about EUFOREA and register for the EUFOREA educational events on the euforea.org website, where you can also sign up to receive the latest news via email. Now, we're also on social media as well. Yes, everywhere, on YouTube, X, LinkedIn, Spotify, Instagram, TikTok, and Facebook. Please do follow us. Now, also, these shows would not have been possible without our partners, so a very big thank you to our platinum partner, Sanofi Regeneron, and our silver partner, GSK. And all that remains for me to do is to say thank you very much indeed for joining us for this year's Global CRSwNP, or Nasal Polyp Syndrome Awareness Day. From all of us here, a very goodbye.